takes a whole army, it takes a whole village to actually turn an idea into a realization, into a reality.
Could you tell us about NobleDr? When did you form the group and what led you to set it up?
So NobleDr is a non-profit organization that was set up in 2021. We consist of a group of doctor, family physician to be precise. We are hoping to create awareness in the community about what is family medicine, how family physician should function in the community, and at the same time do more on ground activities like what we are doing here today.
Who are the others in the group?
We started with a small number of family medicine trainees, consists of 9 of us, and now we are expanding. As you can see today, there's 16 of us that attended the event for today, the program in school. We also have on board an accountant helping out with the accounts with NobleDr. We also have a media person, so she's our social media manager. We call her Effa. So, and on board, other than social media, other than accountant, we do have external members who give us advice, like my superiors, doctors, and other specialty in obstetric and gynecology, who give us a lot of women health advice. So we are slowly growing, and we try to make full use of the resources that we have here.
What do you hope to achieve with NobleDr?
We hope to achieve being more engaging with the community on ground. But over 2 years of being with NobleDr, I see the importance of getting in other stakeholders being involved, not just the NGO, but the corporate world, and also to make doctors to be more aware of their actual function in the community. So rather than sitting in the clinic, looking at today's program, I think the doctors are very happy being out of clinic as well, to be more engaging with the community. Yeah.
What has NobleDr contributed to the community?
We started off in 2021, where we were actively assisting the flood situation that happened in Shah Alam. Prior to that, I had a vision of incorporating NobleDr with the private sector, but coincidentally the flood came along and we quite started off with that. And we had a very good experience in handling on-ground clinics. So what we did was we sent a group of doctors to Dengkil to handle field clinics where we see patients who are directly affected by the flood. We also work together with the refugees community. So we help a few refugees with their pregnancies, handling their financial hospital bills, and also providing care when the baby delivers and provide consultations. We do also do some other community outreach such as Idul Fitri and also the Quran recitation with the refugee communities, and we had a mini Buka Puasa gathering with the refugee communities to be more involved with them. So recently we had a grant that was given by KKM to actually promote about mental health. That's when we decided to have this approach where we focus on the children at school, hoping that we could teach them early about coping skills, teach them early about real life out there, teach them early about how to learn to be more resilient and to be more to be ready when they step into their adulthood. Yeah, so it's a very dynamic, it's a very big field that a family physician can tackle. So I think coming from a family physician background, I feel that whatever that we are doing are quite relatable. Yeah.
Were there any financial challenges you faced?
To be sustainable as an NGO is a very difficult challenge. It is something where you need persistency and consistency doing so. So I've tried many options. So the first thing was, of course, the donation from the public. I think that was the most crucial and important piece of a journey that I will never forget. The people of Malaysia, they are very generous, they are very kind, they are very helpful. So we are a nation where we help each other grow and survive. So that is a very good skills and very good behavior of Malaysians. So other than that, as we soon progress, as people see and appreciate the work that we do, we sort of applied grants. I'm so thankful that KKM, the Health Ministry, are here to support the initiative of an NGO. Moving forward, I would really appreciate and I would really hope that we get more funding from the corporate side. Working with Gardenia for Be Mindful was a very good initiative, and I'm so thankful to Gardenia for that. We also hope more companies and corporate do contribute to a good cause. So by donating to NobleDr, you are basically donating for a good healthcare for the community, especially the one that's very, very difficult to reach a good health service. So you can donate by going to our website. So we have our donate page on nobledr.org. You can also reach us on Instagram, Twitter, and also LinkedIn. There will be someone answering your questions. Yeah.
If you had to do it all over again, is there anything that you'd do differently?
If I were given the chance to do this again, I think maybe I would start earlier. Yeah, I would definitely start earlier. So I came to this realization where being more contributing to the community, being more helpful, being more engaging when I'm only at the age of 30. So similarly goes to my mental health. So coping skills, learning to be mindful, it all came to me in late 30s. So no, early 30s. So I think one thing that I definitely would want to change or do things differently, maybe start earlier. Yeah.
What's your hope for Malaysia?
My hope for Malaysia, my hope for the community would be it takes a whole army, it takes a whole village to actually turn an idea into a realization, into a reality. So own your ideas, gather similar, like-minded people, work with them, share with them your vision, how you want things, how you see things to be, and those people who think alike and would want you to see you making it into a reality will actually support you. So my message to people out there is own your ideas and work with like-minded people to actually make it come true. Yeah.